You should remain as fit and active as possible. There are some exercises you can do before your operation, and you can watch these in the next section. It is a good idea to visit your dentist before your operation. Loose teeth, cavities, or poor mouth hygiene can lead to infections in the area of the operation. Skin problems like eczema, psoriasis, and rashes, along with any other open wounds or scratches, can also cause infection. It is important that you tell your clinical team about any of these as soon as possible. The same applies to your toenails and feet. If they are in poor condition, please see a podiatrist or your family doctor before your operation. Please take care, especially with pets and when gardening, as cuts and scratches may result in your operation being postponed. Where possible, try to avoid colds and other infections, as again, these may delay your operation. If you smoke, now is the time to think about stopping before your operation and staying smoke-free during your recovery. Ideally, you should stop smoking about 8 weeks before your operation. This greatly reduces your risk of developing complications. If you continue to smoke, you have a higher chance of getting a wound infection, and bone healing will take longer, or bones may not heal at all. You also increase your risk of developing a chest infection and are more likely to have a heart attack or stroke during or after your operation. Ask your local health board or your family doctor for the contact details of your local stop smoking services to receive free and confidential advice, as well as subsidised nicotine replacement therapy. Remember, the longer you are smoke-free before your operation, the better the result. Even if you've tried giving up before, it's worth having another go. Alcohol may also affect your recovery, so it's important to stop drinking alcohol or at least reduce your intake at least 1 week before your operation. It is important to eat well before your operation. Have regular meals, and if you find yourself losing weight, please discuss this with your nurse when you go to the hospital. A common complaint following surgery is constipation. You can reduce this by eating plenty of fruit and vegetables and by drinking lots of water before coming into hospital and while you're in hospital. Remember, all these things are very important in helping to make your recovery as fast as possible.